Okay, so today we've got a really important health update, especially for parents. With kids heading back to school, there's a new wave of COVID making the rounds, and it's showing up with a very specific and pretty painful new symptom. Let's get right into what you need to know.
So, this is the question, right? Your kid comes home, they've got a sore throat, maybe a runny nose. Your first thought is probably, oh, it's just that back-to-school bug. But health officials are warning that one very specific type of symptom could actually mean it's something more.
Well, doctors are hearing this one really specific, kind of scary phrase from patients, jilet gibi. It's Turkish, and it translates to like a razor. They're using it to describe this incredibly sharp, painful sore throat that's becoming a signature of a new COVID variant. So we're not talking about your typical scratchy throat here. This is a whole different level of pain. So what's causing it?
Well, the culprit has a nickname, Nimbus. It's an Omicron subvariant, and it's the one that's behind this new wave of symptoms. Let's take a closer look at what this thing actually is.
So this new variant is called Nimbus. The official name is, NB.1.8.1, but let's just stick with Nimbus. It's an Omicron offshoot, and health authorities are directly linking it to that razor-like sore throat. And get this, it's already responsible for a big chunk of new cases, making up about 43% of recent infections in the United States.
All right, so let's break down the symptoms. The two big ones, the ones you really want to watch for, are that super sharp, razor-like sore throat and swollen lymph nodes in the neck. Those are the big red flags. Beyond that, a lot of the other symptoms are what you might expect: runny nose, headache, fatigue. But what's interesting is that this strain also seems to bring more gastrointestinal issues like nausea and diarrhea into the mix. And this is where it gets tricky for all of us parents, right? Because when you look at the other symptoms, it's incredibly hard to tell the difference between this new COVID variant and a regular old cold or flu. And that overlap is causing a ton of confusion. I mean, just look at this. Put them side by side and you can see the problem. Fever, cough, headache, runny nose, it's pretty much the same list. The only real giveaways might be how intense that sore throat is and maybe those stomach issues. But even then, it's no guarantee. The bottom line, you just can't diagnose this by playing symptom detective.
So what's the crucial takeaway here? It's simple. If your child has these symptoms, especially that really bad sore throat, the only way to know for sure what you're dealing with is to get a test. Health authorities are being super clear about this. A proper diagnosis needs a test, period.
Okay, so when it comes to testing, you've got a couple of options. PCR tests are still the gold standard. They're the most reliable because they're looking for the virus's actual genetic material. Then you have the rapid antigen tests. They're way more convenient for sure, but they're less sensitive. That means you could get a false negative. The official advice is pretty straightforward. If that antigen test comes back negative, but the symptoms are sticking around, you should test again in a day or two just to be safe. Okay, let's zoom out a little and look at the bigger picture here. Because with kids back in school, we are definitely seeing a real impact, and the numbers really back up what a lot of families are feeling right now.
Get a load of this number. Just this past August in the U.S., emergency room visits for kids aged 0 to 4 jumped by 15.2%. That's a big deal. It shows that even if the illness is mild for most, it's still causing enough worry for parents to head to the ER. And if you look at this chart, you can see exactly who's being hit the hardest. That first bar, the little ones, the 0 to 4-year-olds, that's where the biggest spike is. And it makes sense with what ERs are reporting, a big uptick in kids with respiratory infections right as summer ended.
Now look, I know those numbers can sound a little scary, but it is super important to put this in context. Health organizations like the WHO are stressing that even though cases are up, the rates of severe illness and hospitalization are staying low. So for the vast majority of kids, thankfully, this is still a mild illness.
Okay, so you've got all this info. What do you actually do if your child gets sick? Let's walk through a simple, straightforward action plan. All right, it's basically 4 simple steps. Step 1, isolate. Keep your child at home so they don't spread it around. Step 2, test. Figure out if it's actually COVID. Step 3, contact your doctor. Let them know the results so they can give you the best advice. And step 4, for most kids, is just supportive care. Plenty of rest, lots of fluids, you know the drill. Basically, treat it like you would the flu. And one more really important point here, especially for kids who might be more at risk. If your child has a chronic illness, like asthma or a weakened immune system, you'll want to be extra careful. It's a really good idea to have a chat with your doctor about whether a vaccine reminder dose might be a good move to keep them as protected as possible. So,
all of this really leaves us with a big question, doesn't it? The arrival of this Nimbus variant with its razor-like sore throat is a huge reminder that this virus is still changing, still evolving. It really makes you wonder, can we ever just assume a bad sore throat is just a cold anymore? Something to think about. Thanks for tuning in.